Choosing partners in care for your loved ones means entrusting them to an organization full of people who prioritize compassion and dignity and just a high level of excellence for those that they're caring about.
We come right alongside a patient wherever they are in the process, and we have them at the center of everything we do and the decisions we make.
They're the most caring and competent people that I've ever seen working with people, and I've seen them working, and the family appreciates it, the patient appreciates it, they love to see them coming, and it's just very special.
I couldn't have asked for anything better than to be involved with these people that work here.
I can personally speak about the care that they've provided. I had my own father on our hospice services, and when the team came in and cared for him, it wasn't just him, it was my mother and the rest of our family as well.
Hospice and palliative care is different than any other form of medicine. We work as a team because we treat people as a whole. It's not just our bodies or our disease or whatever organ's not working, it's our bodies and our mind and our spirit, and that's the focus of what we do at Partners in Care, is to treat patients and their families and treat them as a whole person.
The earlier you can get it on it, the better. Hospice, they provide so much more than just medical care. They provide for your family. They help you emotionally. They, obviously the physical, they help with that. But if you come on too late, you miss all of that. And I think people are scared of hospice because we don't talk about death in America.
When the determination hospice was made, and we got a nurse and a social worker, and they started settling me into the caretaking stuff and the planning and so forth. And the nurse taught me everything. And it became a very rewarding kind of thing. At first it was, oh my gosh, I can't do that. But when I look back on that, it's the best thing I ever did, I think.
Partners in Care is a family. We operate as a family, and we provide a care as a family. Even people who doesn't have family to take care of them, there is someone will be with them by their side on the end of life.
The organization is extremely pure. It's pure in its motivation and its mission, and that is from every staff member all the way to the board.
All the nurses, all the staff, all the doctors at Partners in Care bring that special compassion, that desire to serve, right? It must be their connection just like it is for me. And so that shows up every day.
We did something for him, and this is hard. He hadn't seen his mother in years and years, and our chaplaincy paid for her to fly out here from Arkansas. And she walked to the door and she said, "That is my baby." And so that was good. That was a good memory.
We start working with individuals and families as early as possible to make this transition an important time. It's a very important time, and it should be something that family members can reflect on as positive. And that sounds a little strange, because who could say that was a positive time? But it's those last times you have with those family members.
Hospice was not a thing to even think about. It was just as death, Oh, sure, we're all going to die. What was it Woody Allen said? I know I'm going to die, I just don't want to be there when it happens, that thing. Didn't talk about it.
Our culture needs to understand death and accept death better. We need to be able to take care of our elders and embrace aging, embrace these things that we go through as human, the human story.
We think about hope as like something out in the future, and I think what happens when people, specifically on hospice, is that hope redefines itself.
One of the things that hope means for somebody who might be nearing end of life is the fact that no matter how many days they have left, they're able to actually have quality of life during those days. And that just allows hope to emerge in a new way.
Hope is not looking out there, it's looking at the here and now and how we can help individuals who are facing death and their families and people that surround them redefine what hope might mean.
There's always things we hope for. They may hope for more time or for less symptoms or to be at a certain event or to see a new grandchild or whatever ceremony or live for another birthday.
I think I have more hope than I did. It was overwhelming to think of everything that I want to accomplish. But, you know, things like Partners in Care, putting together a team to help me get my quilts done. That's huge, because that was really important to me. So it gives me hope that it's actually gonna happen.
The way that they cared for my father with such compassion is something I will never forget.
I'm ready to go when God takes me. So I'm at ease, and I just want to enjoy the people I love, and I'm good with it.